Thank you for logging in to hear parts of the NPA Winter Conference this year. Over the course of the week, beginning the 9th of November, we've heard from a variety of great speakers. And we've been delighted to have shared these 7 sessions with so many NPA members. You can catch up now with any of these sessions by listening to the recordings on demand. You also have the chance to hear a special message from the Pharmacy Minister, Joe Churchill. The opening session of the conference focused on community pharmacy in England. It contrasted the public and political support that the sector has with the reality of the current funding for the sector. We illustrated this by sharing the conclusions of the NPA commissioned report by the advisory group EY. Presenters looked ahead to the future and considered the opportunities presented by new clinical services, changes to funding, the way that we interact with the NHS system, and how we as a sector represent ourselves. Session 2 was all about discussing hot topics in community pharmacy practice. The majority of attendees rated this session as excellent or very good. Watch the session on demand and hear about invaluable resources on PPE, COVID-19, flu vaccinations, PQS, and many more. You might want to keep this presentation to hand, and you might want to refer to it time and time again. Session 3 was all about the changing workforce agenda. As your time becomes more and more limited, and with added pressure to offer more services within your pharmacy, you might want to use the checklist we shared during this session to ensure your workforce are ready for the challenges to come. Session 4 was brought to you in partnership with some of our NPA recommended business partners, MedicSpot, Instant Dentist, and Real World Analytics. Being smart with your patient interactions can result in finding ways to increase your income opportunities. The session explored simple ways to harness data from your pharmacy and use technology to improve your business. The vast opportunities from private and NHS services were highlighted, along with some helpful tips to implement sustainably. The focus in session 5 was listening to the General Pharmaceutical Council, who was sharing their insights on providing pharmacy services at a distance. Claire Bryce-Smith, Director of Inspection, was joined by Inspectors Andrew Michael and Stephanie Jackson, giving their key insights on the themes, patterns and trends in internet pharmacy. And Jasmine Shah from the NPA provided answers to some of the members' questions. Demystifying apprenticeships was the theme of session 6. NPA Learning and Development pharmacist, Heenal Mald, welcomed Cube Learning's Alistair Ling to explain the pharmacy retail apprenticeship. This cost-effective package could save you time and money in sourcing and training a new pharmacy assistant. Asvin Chown of Pharma Wealth joined us for session 7. He explained why it's important to know your numbers and why being prepared for your future benefits you, your family, and your business. And finally, I mentioned we were delighted to hear from Pharmacy Minister Joe Churchill. It's really good to have Joe speak at an NPA conference, and that follows on from Matt Hancock's appearance at our event earlier in the summer. We believe the entire ministerial team at the Department of Health and Social Care, including the Health Secretary, have a genuine regard for our sector. And this is the foundation upon which we continue to press for meaningful action on funding. Substantial additional resources are needed urgently to keep vital pharmacy services going. Have a listen to the Minister's message, and thank you again for joining our conference.
Hello, I'm grateful to be able to speak to you today at the National Pharmacy Association Winter Conference. The theme of your conference is building resilience and sustaining community pharmacy in an unpredictable year. A very appropriate theme, if I may say so. COVID-19 has had an impact on community pharmacy, but it has also provided opportunities. Now, more than ever, people see their community pharmacy as valuable and approachable and part of the NHS that they know and trust. This is a good opportunity for me to thank you all for your hard work during the pandemic. We are living through extraordinary times, and I recognise the outstanding contribution that pharmacists, pharmacy technicians and your whole teams have made and continue to make in really challenging circumstances. Your resilience throughout the pandemic has been truly remarkable. The challenges faced by the health system as a result of COVID-19 have seen community pharmacy teams across the country go above and beyond to support your public, your customers, your patients. It's right that your place is at the heart of our communities, which makes your role in our health service so critical. The pandemic has reinforced the importance of the sector to everyone. Community pharmacy is often embedded in the most deprived and challenged communities and provides access to trusted healthcare professionals. You offer the range of important services, timely, safe supply of medicines, the health advice and health and well-being support to an increasing number of clinical services. It goes without saying that we face a very tough winter with COVID-19 infections rising and the country once again in lockdown. It's more important than ever that the NHS works together to ensure that all patients can access the services they need as safely as possible, whether they have COVID-19 symptoms or other health needs. I know it won't be easy, but I also know that you will rise to the challenge. We're in a much better position than we were in March of this year. We know much more about the disease and how to treat patients. Community pharmacies, having remained open throughout the pandemic, have the experience of working in a COVID-secure way, protecting patients and staff. And of course, this time around, local business continuity plans are in place. The actions taken by the Department and NHS England and Improvement in collaboration with the sector and the changes made earlier this year to support your work will also help us all this winter. I'm thinking of enabling verbal consent, online consultations and flexible opening hours, all things that I've been asked for. The Pharmacy Quality Scheme, which incentivises community pharmacies to make their premises COVID secure and do risk assessments for individual staff, and you can now order PPE through the portal. I'm nevertheless talking to frontline pharmacy staff regularly, together with national bodies for pharmacists, pharmacy technicians, about what more we can do to support you. I know that everything isn't always working as smoothly as we would like it to. I'm in particular thinking of the difficulties some community pharmacies have faced with NHS Test and Trace. The guidance has now been clarified and where appropriate PPE worn. Pharmacy teams are not required to self-isolate. I know community pharmacies will face challenges head-on in supporting their local communities through medicines delivery service, which has been reintroduced from the 5th of November, and continuing to give advice and reassurance to those most vulnerable in our communities through the difficult months ahead. Community pharmacy has also played an important role in the flu vaccination programme. This year, more than ever, it's really important that those eligible for a flu vaccination receive one, and I'm pleased that community pharmacies have been helping us meet our targets this year, working with GPs and others. You have vaccinated more people than ever before. We're also thinking about the COVID vaccination programme and the role of community pharmacy in it. There is the opportunity for direct commissioning to some community pharmacists, but not all due to the presentation of the vaccine. Nevertheless, I urge you all to start talking to your pharmacy PCN leads now so that GPs and community pharmacies team up locally for the vaccination programme. COVID-19 has, of course, had an impact on the delivery of the Community Pharmacy Contractual Framework 5-year deal, but I remain committed to the joint vision set out in that deal. The vision of community pharmacy integrated in the NHS, delivering more clinical services as the first port of call for minor illnesses, and taking pressure off other parts of the NHS and using pharmacist skills. Some of the new services we were going to pilot or implement have, of course, been delayed because of COVID-19. But we are reprioritising those services that support the NHS in its fight against COVID-19. For example, GPs can, since this month, refer patients to the community pharmacist consultation service, and we will introduce the discharge medicine service in January, ensuring that people leaving hospital are better supported in getting the best from their medicines. Now, funding. I know it's of acute concern to community pharmacy, and in the short term that we made $370 million available in advance payment to address cash flow pressures. Additional funding for costs incurred as a result of COVID is being actively discussed with the PSNC, and we're carefully considering how other representations on how we can further support community pharmacy so you can carry on delivering can be assisted. Finally, it bears repeating that the outstanding effort of community pharmacies during the pandemic, staying open, dispensing medicines, providing health advice and supporting local communities, being there when everyone needed you. Community pharmacy teams are performing an incredible job on the front line during these unprecedented times. Thank you again for giving me the opportunity to speak to you today, and I hope it won't be too long before we're all able to meet together. Thank you.